Marcia Basciano. I practice in the suburb outside of Chicago in DuPage County, Downers Grove, and I've been practicing since 1978, 35 years. Well, when I went to dental school, and 2% of practicing dentists were women, and dental amalgam, mercury fillings were the only filling available, I learned to place really nice shiny fillings, but I was also told that occupationally they weren't healthy for me, that I should be careful with the mercury issue about it, though it was very safe for my patients. I heard about a dentist in Colorado that observed that his patients were better without the mercury fillings, and so I went out there and went to one of his seminars, and his seminar was very interesting, but it was mainly observations and anecdotal evidence. And at that meeting, Mike Ziff and Murray Vimy were also present, and they stood up and said, "We need some science to back this," and the IOMT was born. And I like to think I was reborn that day as a dentist. Personal attention is very important. Any dentist is in a person's personal space right off. And I just think that between the fear that can come across, the investment of their time and money, I think they need the confidence in the dentist, and that confidence is just perhaps going in the room and sitting for the first 15 minutes and listening to that patient. We like to pride ourselves in biocompatible dentistry. That is, we recognize each patient has unique needs and wants. That's pretty common in dentistry, but we like to think we take it one step further and we recognize their whole health. That we recognize that they may have sensitivities, allergies, or just fears of certain dental materials, and we try and educate them, and we try and fulfill those desires of theirs. I've had husbands tell me I've given their wives their lives back. I've had patients that say, "Gee, it's great, I can eat now, I don't have a metallic taste in my mouth," and something as simple as that can really enhance your quality of life. I'd like a patient to feel, at the very least, that I gave them my sole attention and that I value them as a patient. I'd like for them to feel that that we customized the materials that we used for them, and that we're proud of that fact that we were able to do that for them. I would say that any dentist has a very wonderful sense of fulfillment when they can enhance someone's smile, make them more confident, or give them an ability to chew without pain or sensitivity. But when you're working with a patient and you think about the whole body and the repercussions of what you're doing, the fulfillment just skyrockets beyond that. So I find it very fulfilling to do this kind of dentistry. We would love to hear from you. Please give us a call. We'll answer your questions and we'll listen to your concerns.